Hello everyone, welcome back to another learning video. In this one today we will discuss child-aware practices. Before I begin, please note that I refer to the Good Practice Guide to Child-Aware Approaches, Keeping Children Safe and Well paper in this presentation, which is produced by Australian Institute of Family Studies. This informative paper that they've produced is a great source of information to understand child-aware practices. So let's begin. In this video, we would cover what child-aware practices are, why these are important, what philosophies guide these practices, and what are the 10 key principles underpinning the child-aware approaches. So what are child-aware practices? These are the practices that focus on ensuring that children who have some complex or multiple needs are receiving the appropriate support from the services that are working with their parents and carers, considering both parenting needs and the needs of the children. Child aware practice is about intervening early in the lives of children to see whether the issues impacting on their parents are also impacting on the children. Here's an example of when these are to be used. Issues like family violence, drug misuse, and homelessness can have profound impact on the development of child's brain, which further impacts their emotions, behavior, physical health, and their sense of safety. Child protection services do not deal with daily lived experiences of children, and thus a child could be facing a lot of issues, but the system cannot do anything because interventions doesn't occur until a critical incident occurs. Now that's why it is vital that practitioners they both talk about children as a part of their relationship building process with clients as they gather background information, and they talk about the parent child relationship early in the working relationship, as this makes raising concerns or offering support less threatening as the relationship progresses. Now let's talk about the importance of these practices. Protecting children is everyone's business, and these practices not only protect and promote the children from harm and abuse, but also ensure that a safe environment is provided to them where they can thrive. These support the early interventions. Postponing talking about children may place children at risk if their needs are not considered. A focus on early intervention and prevention is the most co- cost effective in the longer run than responding to the crisis or treating the impacts of abuse and neglect. Now, lastly, these also upheld the rights of children, giving them a voice in the matters that affect them the most. Now, here we have the philosophies that guide the child aware approaches. Child aware approaches are family sensitive, child inclusive, strength based, collaborative, and culturally competent. I will now explain these philosophies and the principles underpinning these philosophies. First one is these are family sensitive. So what does that mean? Which this means that it recognizes the importance of families. Family sensitive approaches support clients in their parental role as well as taking into considerations the need of their children to improve treatment outcomes and maintain the safety and well-being of children. Now, in terms of being child aware, family sensitive approaches require considering a child's role as a parent and how they're presenting issues, for example, drug, alcohol misuse, mental health, how these may be influencing the child. Now, here we have two principles. First principle is identify and respond to the needs of adults who are parents. So, as an organization, it is important to understand if the client has any sort of unresolved trauma that may be affecting their parenting capacity. Second principle is acknowledge and build on family strengths while responding to family stresses and risk factors for child abuse and neglect. Now, family is a complex and diverse construct and may have different meanings for different people. So, it's important to consider whether your organization's intake and assessment procedure identify if the client has a parenting or caregiving role. That means if they are coming as a family and can their strengths be utilized under that. Second one is child inclusive. This denotes that a service and practitioner who will identify a client as a parent and then incorporate into all aspects of their practice a consideration of the child's needs, safety, and well being. Child inclusive approaches require that organizations acknowledge children's needs at each stage of their development, recognize each child's unique perspectives and experiences, and these also provide children with appropriate opportunities to participate in decisions that affect them. Now, in this one, as you see, we have principle 3, principle 4, principle 5, and 6. Principle 4 says recognize and be sensitive to each child's unique perspective. Principle 5 is about including the children into the decision making that affects them. And last one is promoting children's safe environments. Strength based. In the context of child aware approaches, using a strength based approach involves not only focusing on clients' capabilities and resources, but also ensuring that the parenting role is viewed as a positive motivator for change. Organizations and practitioners should also promote parenting attitudes that promote the strengthen children's resilience and reduce their vulnerabilities. First principle that underpin is it says enable parents by promoting their parenting role as a motivator for positive change. Then we have build children's resilience by addressing their vulnerabilities and promoting effective, consistent caregiving. Next one is collaborative. Now, collaboration can involve a range of different activities, including cross training of staff, multi agency working groups, common financial arrangements. This level of partnership may not be required in most cases, but at a minimum, organization working with parents or children should cooperate or coordinate with other organizations to ensure that both parents and children are receiving the support and assistance that they need. Principle 9 says develop and maintain connections between adult focused services and child and family focused services. You, as an organization, need to check if your client is in contact with any other services. Are they aware of these services? And are you in contact with these service providers as well if required? Next one is culturally competent. Now, organizations and workers who are culturally competent take into consideration the historical context and broader social disadvantage that clients may be experiencing. For example, when working with the Aboriginal and Torres Strait Islander clients, it is critical to understand the complex and chronic issues facing these families, such as racism or intergenerational trauma. Now, in terms of child aware approaches, culturally competent practitioners will consider how culture may influence family and parenting practices and how these practices may affect children's safety and well being. So, this principle says understand cultural influences on family and parenting practices and respond in a culturally sensitive way. To understand this better, it is also a necessity for case workers and managers to have an ongoing and updated cultural competence trainings. Thank you very much.